for the final part of the lecture, I will discuss one approach to personalization that we consider specifically relevant for our healthcare settings. This approach is called patient profiling, and it is an example of a targeted personalization approach that I am researching for the case of total joint replacement surgery. I will first tell you a little bit about the method, and then I will show you how you may use it in conjunction with the patient journey map. The patient profiling approach is a relatively straightforward method of personalization, which consists of 5 steps. First, the definition of the target. Second, assessment. Third, classification. 4, adjustment. And 5, evaluation. In the first step, target is defined. This step is meant to provide with an initial understanding of the target population, the context that they inhabit, and any differences that may exist within that group. The patient journey map is an excellent tool to provide you with this initial understanding, especially when you follow more than one patient. This will provide you with a good idea of how people respond differently to similar situations and can help you speculate about what to improve in the current care context. This step ends with a description of the target group, their context, and the target behavior. Again, the patient journey map is also a good visualization tool to communicate these descriptions. In the patient profiling project, the target group are older adults and elderly that undergo a joint replacement surgery. I want to improve the satisfaction of these patients, specifically with communication and education. The second step is assessment. Based on the first exploration of the target group and its context, relevant patient characteristics are assessed. Characteristics are considered relevant under conditions of high variability and 2, accurate prediction of the target behavior. This means that for a characteristic to be considered relevant, differences should exist between patients on that aspect. You should also be able to provide a reasonable explanation as to why that aspect in particular would be related to the target behavior. In the patient profiling project, patients differ in their communicative behavior, their coping style, and their clinical status. These all affect satisfaction after the surgery, so patients that are new to the clinic are assessed on all of these characteristics. The third step is classification. Using the assessments you have collected, you can form groups of patients and assign each assessed patient to a specific group. There are many ways in which you can classify. If you use only 1 or 2 variables, it is possible to map these by hand on a quadrant. If you have collected qualitative data, you can use your teams as a lens to identify the different groups. Finally, if you use extensive quantitative assessments, sophisticated statistical methods such as cluster analysis and growth mixture modeling may be more suited for you. In the patient profiling project, I've used cluster analysis and machine learning methods and identified 3 groups of patients. Once you have established the groups and assigned each patient to a group, you enter the 4th step, adjustment. In this step, reconsider the context that you've explored during step 1. Which aspects of the concept may be changed for each group? For example, what should the patient education flyer look like for people from group A compared to people from group B? Should they visit follow-up consultations with the same frequency? In this step, the patient journey map becomes a valuable tool again, as it provides you with a detailed overview of all actions that currently occur in the care context. This can inspire you to detail where variance should be built in and in what way. In the patient profiling project, we are in the progress of developing a patient education platform that matches the characteristics of the 3 groups. But we have also developed concepts for different waiting rooms and at-home rehabilitation systems. So there are many more possibilities. Finally, there's evaluation. In this step, if you are in a position to do so, You implement your suggestion for Ryan as a pilot in a care context. Ask people to provide you with feedback on the relevance of the variant to them. Examine whether the target behavior occurs more often. This knowledge about the effectiveness of the personalization will provide you with new information to reconsider all the previous steps of the patient profiling approach, from changing the number of groups to changing the assessment. In this way, you will iteratively develop a personalization strategy that is dynamic and continues to fit your challenge and your organization. So, there you have it. A quick introduction to personalization, the explanation why personalization works, and one approach to personalization in the form of the patient profiling method. As I hope you have learned today, personalization is a broad and interesting field that has penetrated most modern businesses, but is only slowly gaining traction in healthcare. So whether you tailor, target, or customize, I hope that this lecture inspires you to continue to align care services with the people that use them to improve the future of healthcare.